You're approaching Medicare and you're deciding between original Medicare and Medicare Advantage. One factor you're going to think about are the costs. And there's a way that I go through it with clients to help them see the difference. I'm going to tell you about a client I talked to today. Before I go there, if you want to learn about your circumstances, click here to learn more, and I'm happy to go through the same exercise with you. So the client, as I mentioned, I met him on TikTok, lives in New Jersey, and we looked at his zip code, we looked at his age, we talked about doctors, medicines, all that kind of stuff. And what we figured out is if he chose Medicare Supplement Plan G, he would spend about $1,900 in annual premium without even walking into the doctor's office, but he would know that he's managed his costs. The only out-of-pocket that he would have for medical costs would be the Part B $226 deductible. If, on the other hand, he chose a Medicare Advantage plan based on his zip code and he chose a PPO, the plan we were looking at, he'd have a $7,400 max out of pocket. So what I mean by that is he would pay a $0 monthly premium, but if he had a bad health year, his exposure is up to about $7,400 of possible copays and coinsurance. So the question is, which is a better setup for you? Would you rather pay up front with original Medicare, for the supplement and Part D plan, whether or not you needed care, but you manage your costs? Or would you rather eliminate those costs, those monthly premiums, but your exposure is higher if you do have a bad health year? So which is better? It's really going to depend on you and your circumstances, and that's part of the discussion that I have with clients when I help them navigate Medicare.